My name is Panya. I am the recent mother of two twins, a girl and a boy, and they're 4 months old. I was 39 years old when I had them. I am now 40, and I live in Brooklyn, New York. We found out in the doctor's office, so we had been trying to get pregnant, so it was not a surprise, but it was just amazing because I'd had a miscarriage before, and we were working on it, my husband and I, and the doctor told us, and we were over the moon. We were over the moon. And then, then I got nervous, gosh, I hope I don't have a repeat of the last experience. But, my husband and I, we did a lot of positive speak with each other to encourage each other and to, have faith. And maybe because I'm an older mother, I guess with age comes a sense of, I felt empowered in the process. I don't know why I felt that, but I do know that I had to talk myself into that because generally, the doctor is an authority figure. That's kind of how we are trained. This is an authority figure, command and control, as opposed to partnership. And I guess through, my own education and my own life experience, I just saw this as, this is like any service. I am paying for this service. Even though my insurance is covering it, I am still paying for this. I have a right to choose. And I didn't start that way because I was afraid. I really had to remember that there are many doctors out there, and there are many very good doctors out there. There are also many very good doctors who also have really good bedside manner. So why don't we just take our time to find that? I did say that I didn't want to be kind of coerced into a C-section. I knew that if I waited to a point where I was feeling ill or there was something wrong or I was in the delivery phase, that I would be more likely to just do whatever anybody told me, because they'd say something's wrong with your kids, and I'd say, okay. So it was important for me to get that sorted when I was calm. We were not in an emergency place, so that I could have my wits about me. I was working with this particular doula, and she very quickly, I felt very much that I trusted her very quickly, just in the way that she did relationship with me. And so I wound up kind of allowing her to be my go-to person, just because she established a rapport. It was like relationship 101. And she recommended this midwife. My doula had had a twin birth, and this midwife actually delivered her twins. And so I went and I met with her, and I was just like, okay, here it is. Just kind of was like, experience. From early on, I realized that it seemed that there was the potential for me to get more negative messaging than a woman who was having a single child, because I'm sure there are more risks. I'm sure that these things are valid in a certain context. I just didn't want to allow that to change my experience, because my whole goal was to stay out of stress, because the more stressed I was, the less likely I would have a positive outcome. That was my belief. So I kind of accumulated positive birth stories, and I kind of kept close to the people who told me and believed that I would have a very positive experience. And my husband has been supportive from jump. I know that made a difference too, because he could very well have said, no, we're going to have to do it in a hospital and, go the conventional route. But he was very supportive, and he always told me, yeah, you can do this. Your body's made for this, And if anything goes wrong, we have a great caregiver, we'll just transfer to So we always felt like we had a safety net. But that wasn't the focus. The focus was not on what could go wrong. We kind of planned for that just in case, but we didn't think about it beyond that. Number one is take care of yourself. Take care of yourself. That's probably most important, to be healthy, because as you are healthy, so too will your babies be healthy, your baby be healthy. Number two is keep people close to you who help you to know that you're powerful, that your body is made for this, and that all is well. In terms of your caregivers, remember that you do have a choice, and that whatever your vision is for your birth experience, there's somebody out there that can facilitate that for you. It requires a little bit of patience sometimes. Know that you can do it. You can do it. Your body was made for it. And if anything goes wrong, the help will be there, but you can do it.